Smyth, and I'm joined by quite a contingent of my colleagues in government and VIPs, along with people that are very active in the National Recovery Awareness Month, and that's what brings us here today. I'd like to welcome members of our town board who are with us today. Councilman Sal Ferro, who we'll be hearing from in a moment, Councilwoman Teresa Mari, and Councilman Dave Bernardo. Brooke Lupinacci sends her regrets. I'd also like to thank our Highway Superintendent Andre Sorrentino for joining us, Andrew Rea, our clerk, Jillian Guthman, our tax receiver as well. And I'm going to go through a list of folks that have joined us today. Essentially, everyone here is going to be introduced. If I don't call your name, just shout it out, and we'll all clap. So hold your applause to the end, and if I forget your name, I apologize. So, starting in no particular order either. So don't get a little testy with me here today. It's still early. All right, starting with representative from Nick Lalota's office, Mike Calabrese, who used to work here in Town Hall. My guy. Yeah, he's our guy. Under Sheriff John Becker is with us today from the County Sheriff's Office, along with Deputy Under Sheriff Kevin Heavey. Legislators Rebecca Sannon, Tom Donnelly, Stephanie Bontempi, and Jason Richburg. Village of Northport Mayor Donna Koch. Receiver of Taxes Jillian Guthman. We like to introduce her twice. Just two, because you get to pay your taxes twice a year. Councilman Dave Bernardo. Councilwoman Teresa Mari. Town Clerk Andrew Rea. Janine Salgado, our Director of the Youth Bureau. Barry Sachs from the Huntington Drug and Alcohol Counseling Center. Assemblyman Keith Brown. Senator Mario Matera. From Ray Tierney's office, Jessica Qualpa. Right here. From Town Hall, our Director of Human Services, Kevin Thorborn, the Deputy Supervisor, John McCarron, Chief of Staff, Michelle McCarthy, our Communications Director, Chris Geed is with us. I think she organized this right here. Thank you very much. It was tough getting everybody in the lineup here, but thank you. Todd Cohen, Assistant Director of the CDA, and Angel Cepeda from the CDA is with us. Julia Frangione, our Senior Center Director. Todd Jameson, our Director of Parks. Rob Conti, Assistant Director. Andre Sorrentino again, who does announcement as well. Walter Edwards, his deputy, along with George Schwertle, his deputy. Bill Musto and Joe Reck from General Services, and they're the guys that put things together behind the scenes. Amazing. Here at Town Hall. So thank you all very much. Is there anybody I did not introduce? Gil Picard, raise your hand. There you go, Gil. Hey, thanks, Gil, for coming out. And John Clark, and well, we did not. John Clark is doing a great job at Environmental Waste. And Dr. Piggott, but he's going to be speaking in a moment, so I'll jump back into my remarks and.
Got her.
Ray Tierney's office.
Got her.
Oh, Shannon Wilson? All right. Thank you, Shannon.
Oh, yeah, that's a big one.
All right, I'm going to go right into my remarks. I'm starting to get hecklers from the crowd here. So, all right, so again, once again, thank you for joining us here today. We're going to kick off today's ceremony because, and a quick reminder that the Northport flag raising and press event this Thursday, August 28th at 12 p.m. at Northport Village Hall at 224 Main Street, Northport. And happy to say once again, we're joined by Mayor Donna Koch. So thank you. She will be hosting as well as an annual Night of Remembrance Candlelight Vigil, which is co-hosted by the Northport East Northport Community Drug and Alcohol Task Force, is also this Thursday at 7 p.m. in Northport Village Park. Yeah, you're welcome. And to wrap up this month, which is there's an annual wellness walk for hope and healing. The Hope and Healing Sculpture Festivities at Heckscher Park is on Saturday, September 20th from 11 a.m. to 2 p.m. But today we're starting by turning the town purple. The color purple is used to recognize and celebrate those who are living in recovery from substance abuse. This is the town's third year that we have gone purple in observance of National Recovery Month. Purple flags were installed here at Town Hall and throughout Huntington Village and will remain for the duration of September in Veterans Plaza and along portions of Larkfield Road and New York Avenue. The town of Huntington has been committed to combating substance abuse and opioid addiction in our community. Since 2018, the town has trained all town lifeguards, park rangers, harbor masters, and safety patrols to administer Narcan. And we have held numerous Narcan training classes throughout the town itself, for the town staff, the community, and our youth in the town. In addition to training in 2019, the town formed the Huntington Opioid and Addiction Task Force and held its first Opioid Task Force public forum. Many of the members I introduced earlier are here, and we want to thank them for their critically important work for our community. With the proper training, education, and continued collaboration and vigilance, we continue to save lives. Today, the town of Huntington turns purple to increase awareness of the dangers of opioids, encourage individuals to seek help, celebrate all who are living in recovery. We hope you will join us today and stand with the towns, the villages, and the cities across the country during Recovery Month to raise awareness and to save lives. Thank you all, and at this time, I would like to call to the podium my colleague on the Huntington Town Board, Sal Farrow.
Thank you, Mr. Supervisor. Well, before I say a couple of words, I want to also thank Huntington Hospital. Here with us today from Huntington Hospital, Troy Tim. They've been an amazing partner.
Woo!
What we do, what the task force does, and what the town does, and we're very, very fortunate to have them in this town. So, as town councilman and liaison to the town's opioid and addiction task force, I'm incredibly proud of this team. We've accomplished a lot, and there's still so much to still accomplish. The dedication and determination as shown by its members have made a real impact in raising awareness about addiction and supporting the path to recovery. This flag we raise today is more than just a symbol. It represents the strength of those fighting every day to recover, the families who stand by their loved ones, and the community that refuses to turn its back on the crisis. And that's what this task force is about.
Yes.
It's about community standing behind this crisis and supporting everyone in the community.
100%.
Addiction does not discriminate.
That's right.
It touches neighbors, co-workers, and sometimes even our own families. But recovery is real, and hope is stronger than despair. Over the past year, our task force has worked tirelessly to get the word out, to break the stigma, and to provide resources to those who need them most. From community events to education and outreach, every effort has been made about saving lives and reminding people no one is ever alone in this fight. As we kick off National Recovery Month, let us recommit ourselves to this mission. Let us stand united as a town, strong, determined, and compassionate. Together, we can continue to shine a light on recovery and build a future where every individual has a chance to heal, to rebuild, and to thrive. And before I hand it over, I want to thank the task force. I thank their members, the chair people, all the volunteer work that they do. I've been very fortunate to work with them for the last almost 2 years now. I have 4 months left as the liaison, and it's been one of the most amazing things that I've been privileged to ever be part of. This is an example of a community truly stepping up. They're volunteers. They don't do this because they have to. They do this because they want to, and they can make a difference. I'm thanking you personally for allowing me to be a liaison, and I love each and every one of you for what you've done. Thank you. Thank you for your time again. Chilling, yes, Mr. Silverstein.
Good morning, everybody, and thank you to Supervisor Smith, all the town council members, and my fellow Huntington Opiate Addiction Task Force members. Why are we here? Last year in the United States, there were 30,000 fewer drug overdose deaths than the year before, which is 27% per the CDC.
Wow.
Which at 27% per the CDC was the largest one-year decline ever recorded.
Yes.
And is largely attributed to the enormous public health response to the opioid crisis, as well as to the use of life-saving naloxone and other medications.
Yes.
We are here because an estimated 80,000 people still died needlessly and left their loved ones tragically behind. And one life lost to overdose is one too many. We are here because the overdose crisis is not just about one drug or one group of people. It is about all of us working together to eliminate the stigma, the shame, the guilt, and isolation that still exists, and to continue to increase, not decrease, access to prevention, harm reduction, treatment, and recovery. We are here because addiction is a health crisis and not a crime. It does not discriminate, and overdose can happen to anyone. We are here to raise our voices together with compassion and awareness and understanding of what needs to be done within our community, as only a community-wide effort can end overdose. And we are here in honoring those we have lost and celebrating those who are still here by turning our beautiful town of Huntington purple and raising the recovery flags. Thank you. I wish to introduce Jeff Reynolds, co-chair of the Open Addiction Center.
So a big thank you to Supervisor Smith, the other electeds that are here, my co-chair Mary, and the rest of the members of the task force. You know, a year ago, I stood here and I proclaimed that Huntington had the strongest response of every town, any town here on Long Island, and that continues. In fact, the crowd is growing larger behind us, as you see, precisely at a time when we started to make progress in reversing the trend in overdoses. More folks are coming out to support this cause. More folks are coming out to talk about this issue. More folks are coming out to talk about the need to support prevention, access to care, recovery services, and harm reduction services. That's how we continue to beat this. My hope is that as we raise the flag, that some family will be passing by in a minivan and the kids in the back seat will say, "What's that flag?" And that will start a conversation for that family, whether that's a conversation about the dangers of drugs and alcohol at an early age, or a conversation about an uncle who might have found a path to recovery, or a family member who just went off to treatment and is coming home. Those conversations are absolutely critical. And when we look across the whole spectrum of interventions we have, those conversations are front and center. And so Huntington has done more than start a conversation. They've advanced the discussion in a way that's very meaningful. I did hear Sal talk about his 4 months. I'm pretty confident that you know a guy who can keep you on the task force. My hope is that you will. Sal is just a phenomenal representative of the town, and quite frankly, you know, beyond this event, just the Huntington town staff have just been amazing in terms of making sure that we have what we need in order to move this forward. And so today, tomorrow, Friday, we remember those who lost the battle. And going forward for the entire month of September, we embrace those who are looking for or have found a path to recovery. Thank you to all the electeds here today. Thank you to all the folks who work in the town. Thank you to all the folks who actually do this work with patients day in and day out.
Yes.
This is the most important thing I'm going to say. So, in any group of people, there are folks who come to meetings and it's nice and that kind of thing. And then there are folks who like really get things done. Sharon is one of those people who get things done. Here on Long Island, there are a small cadre of moms who have come together to make a difference in the wake of incredible loss, and they've dedicated their lives to ensuring that this doesn't happen to another family. One of those people is Sharon Richmond. She's here with us today. Thank you, Sharon, for everything you continue to do for us. Thank you for your
I want to begin with gratitude. Such an important word. Gratitude to Councilman Farrow, Supervisor Smith, and all the town board members, and all the staff, from general services to legislative aides, everyone. It truly takes a village, and it certainly we have the best town village here to help one another. So I'm very grateful for that, and in turning our town purple this year during National September Recovery Month. The hope and healing field just rises now in our town. It is more than art. It is a symbol of resilience and renewal. A reminder that even in the darkest times, we can rise again. This month, our towns turn purple, and while we're beginning to see overdose deaths decline, we cannot forget the 80,391 lives we lost just this past year.
Yes.
They were mothers and fathers, sisters and brothers, and our children. Each life mattered. Almost 60% of those were fentanyl-related, a synthetic opioid so powerful that one counterfeit pill or dose can be deadly. For me, this is deeply personal. I lost my only child, my son Vincent, to fentanyl poisoning. That pain will never leave me, but I refuse to let it silence me. In Vincent's memory, I choose to speak, to fight stigma, to stand for every single person still struggling, to say, you are not alone. Each of us can make a difference. A purple light in your window, a purple ribbon, a kind word. These small acts are sending powerful messages of hope. But symbols are only the beginning. We must demand prevention education in our schools. There's no single solution, but there are many different steps we can take. Real prevention needs more than a yearly assembly. Real prevention needs education, woven through daily lessons every school year. Honest, evidence-based lessons that give kids the tools they need to cope, communicate, and make healthy choices. And every healthcare visit should include screening for mental health and substance use, because when treatment is needed, it must be available right away. We must ensure treatment recovery services are not optional, but a priority,
Yes.
and we must keep pushing for positive change. So today I ask you to stand with me, to turn grief into action, pain into power, and hope into healing. Together, we are so much stronger. Let's light our towns purple, declare that recovery is possible, and that no one fights alone.
Yes.
And I'd like to introduce Dr. Gregson Pickett. He's a dear friend, and I am so proud of the work that he's done to help individuals in recovery.
Good morning. I'd like to thank you all for having me, Supervisor Smith, Councilman Sal, my buddy there, but it's good. It's like about 1.7 recovery event. And, looking through my emails, I was out last week, and I saw there was an invitation on Monday. I'm like, oh, okay, when is it? Tomorrow. I'm like, oh, okay, I will be there. So again, thank you for having me. I bid you greetings from the Suffolk County Department of Health. We oversee the Division of Community Mental Hygiene, who has been in this struggle, has been in this fight with everybody in their recovery journey from the beginning. We're going to continue to be in the fight. We convene several work groups of agencies that are also like-minded and looking to end this scourge of opioid addiction and that's related to overdose. I pulled some stats from the Suffolk County Medical Examiner's Office. In 2023, we lost 463 Suffolk County residents due to overdose. In 2024, we lost 320 due to overdose. Yes, the number going down, but that's still very significant. This year, through June, we have lost 94 Suffolk County residents confirmed through the end of June. But there are also another 152 who have not yet classified, people who have passed away but not yet confirmed as overdose deaths. So there's still a lot of work to do. We, as a health department, we have some resources that are available to the public. We have revamped our behavioral resource guide to make it more accessible. That you can find at suffolkcounty.gov/health, and under that page, look for the Suffolk County Behavioral Resource Guide. It's much easier to navigate. There are resources there front and center. You can look by category if you want crisis services, if you want treatment. We also have the SuffolkStopAddiction.org website that has been up for several years now. That is also an excellent resource for those who are looking to begin their recovery journey. Recovery is one day at a time. There are setbacks. There are positive things that happen. There are negative things that happen with people that are in recovery. Yet we want people to persist in their journeys and to find a real sustaining, fulfilling recovery journey. What I can say about that, treatment has never been much more easy to access. That we have these now comprehensive treatment centers that offer medication-assisted treatment, and it's not just a script for Suboxone and buprenorphine, but some are now dispensing methadone, which has been extremely helpful to those in recovery. We're talking about agencies such as Samaritan Gates, Outreach, I think the recovery partners that have these comprehensive centers. So hopefully you can take advantage of these resources, and we are here with you to celebrate recovery. Thank you. Well, thank you, Doctor, and thank you to all of our speakers. And at this time, I would like to say, let's raise the flag and kick off National Recovery Awareness Month in the town of Huntington.
It's okay. You're good. Oh, good. Mary. It's Mary Silverstein from Central CN Guidance and Counseling. It's I'm not sure how the focus is going, but hopefully you can see it. Now we need a nice gust of wind to unfurl it. Come on, gust of wind.
Okay, I do have a deal for you.
Ah,
At cost, it is $65 for a recovery flag, and you can have your very own logo. So every business, any organization, I'm going to say, come join us. We have plenty of flag openings here. So come on down, $65.
Huntington Matters is committing.
Okay, there we go.
Huntington Matters is buying a flag.
Also, I have one more thing to share. We are finishing our final phase on the back wall of the Hope and Healing sculpture. And we have 9 quotes. They can, or actually it could be doubled, because a small quote is $250. A larger, longer quote is $500. So I believe we have 7 left, and I would love to see our final phase done by the end of September. So come join us. Follow True North 1 at Gmail. Sharon Richmond, Michelle Wright here knows how to get a hold of me if you don't know how to find me. And I will get you your phone. Thank you.
Awesome.
All right, thank you once again, everybody, for coming out. That concludes our program for the day. And if there's any questions, we'll be happy to answer. Can you guys spare flag? You guys stand for we can do that. Yeah, set you guys up.
All right, we're taking photo ops. It's okay. It's all right. All right, I'm going to switch this around. Let's see if I can do this. Bear with me. Whoa, front camera, there it is. All right, neighbors. June Margolin, Huntington Matters. Our Huntington Matters team members, let me turn this microphone around. Our Huntington Matters team members, as well as thousands of neighbors in the town of Huntington, New York, have all been personally impacted by addiction, substance abuse. Every single resident, I would say, probably of the United States, knows at least one person personally who is struggling, who's in recovery, who maybe is quietly suffering, and also who has been lost, who has been stolen away from us. So, we have our very dear loved ones that they just did not get to have a full life. They just didn't, because of this disease, the mental illness, and also the substances that are on the market. So you will always find Huntington Matters at the forefront of advocating, bringing awareness, bringing visibility, ending the stigma for those who are suffering, encouraging them that every single life matters. Their lives matter. They have people who love them, even if they're feeling so alone. Even if you are feeling so alone right now, there are so many people that love you that may even be strangers. And there are so many resources available now, thanks to, tons of lawsuits and finally coordination at government levels, national, state, county levels. Alone, we can only get so far. But together, that's when true healing happens, and that's when there is true hope. And if you're struggling, if you're wondering if this is, maybe something you should look into, Huntington Drug and Alcohol, right here in our own town of Huntington, has incredible resources. They will, if you have insurance, they'll work with your insurance. They'll refer you to free things. There are so many programs in Suffolk County that can help you, whether it's AA or inpatient or day programs or group counseling, individual counseling, family counseling, so many different ways. So we're begging you to please choose life, because you are worth it, and you are worth the fight to live another day. I wish I could tell my sister that. I really do. She's gone. Because of that journey, though, is why we're here today. It's why Huntington Matters exists. It's why we are such passionate advocates. And just so you all know that, even though we may not know you, or we may know you, we will never give up on you, ever, for your recovery. So we're standing with you as a community, and we are standing with you as neighbors. And if you ever need anything, any help, any references, any support of any kind, just send us a private message. Huntington Matters. You can send us personally messages as well, and we are all here for you. So this is a very big month. Not just, it's a national month, but the town of Huntington has some really impactful events. This Thursday night, we will be at the Candlelight Vigil. If it is the only, it's an overdose awareness day, and it is the only day in the month where we're really acknowledging those that we've lost. So if you have a loved one or a friend or an acquaintance or colleague or someone inspiring that you lost to addiction, overdose, bring a photo of them. And there's a bulletin board where we pin up everybody's photos. So my sister will be there, Diane's son will be there, and other family members from our team members will be there. If you are there for the first time and you are nervous, uncomfortable, emotional, do not hesitate to come find our team. Diana and I will definitely be there, and we will stand with you, and we will support you as you put your own loved one's photo up on that board. And we have moments of remembrance, and we say a prayer, there's some song, and it's actually very beautiful and uplifting. It doesn't bring them back, but standing together as a community, it does make a really big difference in just yet another milestone towards the healing and the bringing awareness also, and standing together as a community. And then September 20th, big deal. Hector Park, very beautiful event. Hope and Healing. It's the recovery walk, and I have a yellow jacket buzzing around my calf that I'm also allergic to, so hopefully I don't get stung. But right now, we're right across the street right now. They walk around the pond. We have all kinds of resources. So anybody who's in recovery, who is looking for recovery, who is a loved one, a supporter of those in recovery, who just wants to celebrate, just be a neighbor and celebrate your neighbors who are on this journey. It is an absolutely beautiful event, and we always live stream as much of it as we can, and so we'll be there too. So any other things, just hit us up, huntingtonmatters.com, send us an email, hit our socials, private message, any other thing we can help with. Just know you are loved. Thank you, neighbors.